We will get started. Welcome to all of you, and thank you for joining us today for today's webinar on CDC's American Rescue Plan Public Health Workforce Programs. My name is John Auerbach, and I recently came back to work at CDC as the Director of Intergovernmental and Strategic Affairs. I'm grateful to be at the CDC at this critical moment in the response to the pandemic. But this is just day 7 for me at the agency. But in that short time, I've seen firsthand the remarkable work that's being done by CDC's skilled and dedicated staff, led by CDC's Director, Rochelle Walensky, who, while still relatively new, has accomplished a great deal already. I'm particularly pleased today that we'll be sharing some of the specific information regarding the groundbreaking investments in the public health workforce that were made possible by the American Rescue Plan. As a former local health commissioner and a former state public health official, I personally experienced the impact of having too few public health employees in the midst of past public health emergencies. Over the last 20 years, we've lost tens of thousands of public health jobs, making the work at the local, state, tribal, and territorial levels that much more challenging. But fortunately now, with the American Rescue Plan, we have an opportunity to fill many of the gaps and to do so rapidly to ensure we're combating the short and longer term impact of the COVID pandemic. And we're doing so in ways that promote equity by ensuring that career opportunities are available for all, that create a wide range of new positions, and that fund many of them for several years. I believe you will be as excited as I am as you hear about the existing plans to expand the workforce, creating positions for highly skilled as well as entry-level employees. After hearing about several of the workforce initiatives, we'll have considerable time for questions and answers. So please get your questions and answers ready, and you can enter them during the presentations. And of course, after the webinar, you can contact us for more information. Before hearing about the plans, let me offer just a couple of technical notes. First, this webinar is being recorded and will be posted on the CDC website. Second, captions for the webinar are available through the link that has been shared with you. Now it's my pleasure to turn things over to Sherry Berger, CDC's Acting Chief of Staff, to provide more information about today's webinar. Sherry?
Thank you, John. And thank you to everyone for joining as we kick off the next chapter of support for the nation's public health workforce. We're so excited to talk with you today, and we are so grateful to be joined by other federal colleagues from the Corporation for National and Community Service, as well as the HHS Office of the National Coordinator. During the COVID-19 response, we have seen firsthand the impacts of what we all have long known. The nation's public health workforce has been severely stressed and under-supported. Recently, the Biden-Harris administration announced an investment of $7.4 billion from the American Rescue Plan to recruit and hire public health workers to respond to the COVID-19 pandemic and to prepare us for future public health challenges. When we talk about the public health response to threats like COVID-19, we're talking about the public health nurses that are staffing our vaccination sites, the data scientists that are poring over billions of pieces of data, the laboratory scientists processing clinical specimens day and night, and the health workers provided needed support to the communities in which they reside. The new ARP investments we will be describing with you today are going to help build a diverse public health workforce that we need today and that we want for years to come, a workforce ready to face current and future threats. These investments will meet 3 critical needs. They will bridge from the ongoing COVID pandemic to have us ready for the future. They will build a stronger, more diverse workforce and sustain the progress we are making through future investments in our workforce under a new program that we'll be announcing today as well. Our panelists today are going to talk with you about two initiatives designed to meet critical needs set forth in the slide in front of you. Although we won't be focusing on it in much detail today, I do want to take a moment to forecast with you another workforce activity that we will share more information about in the coming months. In addition to the programs you'll hear about today from CDC and our other federal partners, the ARP will allow CDC to make an additional record investment in the public health workforce of tomorrow through a new $3 billion multi-year grant program. In the coming months, CDC will work with public health leaders across the federal, state, local, territorial jurisdictions, and our public health partners to receive feedback on this new grant program. The program will build the workforce that represents the communities in which they work. Importantly, this new grant program will offer the jurisdictions funding that will allow them to move from the urgent short-term goals that we're addressing today to a more sustainable, forward-facing approach, providing staff hired for COVID-19 response an opportunity to continue their careers beyond the pandemic as public health professionals. As I mentioned, we will provide additional details about this new grant program in the coming months. Today, we have 8 workforce programs to outline for you, including collaborations with AmeriCorps and ONC. You can find bios for all of the speakers in an email that was sent prior to the webinar. And in case you miss any part of today's program, a recording will be posted on the CDC website. I will now turn it over to Peggy to start us off. Peggy?
Thank you very much, Sherry. Good afternoon. I'm currently serving as the Principal Deputy Incident Manager for CDC's COVID-19 response and greatly appreciate the opportunity to describe CDC's collaboration with the CDC Foundation to strengthen our nation's public health workforce. Next slide, please. The CDC Foundation is an independent nonprofit partner of CDC. Since the beginning of the COVID-19 response, CDC has worked closely with CDC Foundation to recruit and hire public health staff to strengthen capacity at the state and local level. CDC Foundation has worked closely with state, tribal, local, and territorial health departments, public health leaders, and community-based organizations nationwide to identify the most critical needs and hire and train staff to allow them to respond rapidly to the pandemic. To quickly train newly hired staff and prepare them to help mitigate the spread of COVID-19, CDC Foundation has used established courses supported by CDC, such as those for case investigation and contact tracing. In total, CDC Foundation has placed more than 700 new public health staff in the field during the pandemic. This experience has made CDC Foundation uniquely qualified to lead efforts to rapidly expand the public health workforce to respond to the ongoing needs of the pandemic. Recognizing the potential for this innovative network and the crucial need for frontline public health capacity, the American Rescue Plan provided CDC Foundation with $200 million in additional resources to bolster and further enhance the network's reach. This new funding will allow the CDC Foundation to build on previous successes to expand the public health workforce capacity across states, territories, large cities, tribes, and local and frontier communities through large-scale recruitment, selection, and onboarding of critical surge staff to meet immediate needs. These staff include, but are not limited to, epidemiologists, laboratorians, and infection prevention and control experts, as well as administrative and financial specialists, communications specialists, and IT specialists. And importantly, this effort also includes the recruitment of supervisors and senior and mid-level managers to respond to the new needs in the current and rapidly evolving environment. CDC Foundation plans to hire over 2,000 staff to support jurisdictional needs. This project will continue to build strong linkages between state, territorial, city, and tribal COVID-19 response efforts and vital community-based efforts to reach vulnerable populations. Next slide, please. Community-based organizations are vital partners in the public health system and integral to ensuring meaningful impact on health outcomes. The CDC Foundation is working to build the capacity of these organizations to promote vibrant, healthy, and resilient communities through effective partnerships, strong multi-sector collaborations, systems-level approaches, and movement building. Community-based organizations use their deep connections and their role as trusted resources within communities to improve economic, social, physical, and emotional well-being. The CDC Foundation provides targeted technical assistance to community-based organizations and encourages crucial connections between these organizations and local health departments to address the community needs. The expertise and capacity of surge staff will be enhanced through trainings, webinars, and other learning tools to improve the performance. And key outcomes that we anticipate from successful implementation of this project include strengthened capacity and coordination throughout the COVID-19 public health response, increased capacity of the public health support workforce, improved performance of surge staff leading to increased work outputs and improved outcomes, and strengthened capacity among community-based organizations to understand and align with the COVID-19 public health response. The COVID-19 pandemic has highlighted many areas that need to be strengthened and resourced to address both the current response and future work in public health. The CDC MMWR report last Friday highlighted the toll that the pandemic and response has taken on the public health workforce in the United States. This important work with the CDC Foundation will build on the lessons learned from the last 18 months and will focus on addressing gaps in the public health infrastructure, which includes building a stronger workforce for the future. And with that, I would like to turn it over to Chris Cosmos, who is going to speak about CDC's crisis work. Chris?
Thanks, Peggy. And thank you everyone for joining today. I'm going to talk about the recently awarded $2 billion to our 65 recipients, including one tribe. Next slide, please. CDC recently awarded in May $2 billion through the CDC Crisis Response Cooperative Agreement. These funds are intended to expand, train, and sustain the state, local, tribal, and territorial public health workforce, including school health as well, and more to come about that in a minute. This $2 billion that was awarded is separate from and in addition to $755 million of funding that CDC awarded through the Crisis Response Cooperative Agreement in March of 2020 to the same 65 jurisdictions. This funding is different, and that is really geared towards workforce development, and it has two tracks. The first track is to support the public health workforce at the state, local, and tribal and territorial public health. And the second one, again, is to support the school health workforce in specifically K-12 schools, including public, private, and charter schools. It is a 2-year cooperative agreement, and the funding actually starts this Thursday, July 1st, and runs through June 30th of 2023. One thing about this particular mechanism that might be a little bit different is that CDC is allowing for pre-award costs that start with the guidance award of May 13th. So if there are pre-award costs related to workforce development, that may be allowable for reimbursement starting on May 13th. We are encouraging, and the guidance talks about how states, locals, tribals, and territories should really think about this funding. And again, it's we're asking you to think broadly about what are the remaining workforce needs at all of those levels for COVID response, COVID prevention, and COVID recovery. We've included in the guidance 5 broad categories of staff. And you could think of these as not only FTEs, but also contract staff or term staff as well. The first category that we speak to are administrative staff and support staff, including staff that may be able to support you with grants management activities and fiscal activities. The second category that's outlined in the guidance is related to clinical or professional staff, including laboratorians, epidemiologists, physicians, nurses, behavioral and mental health staff. Third category includes disease investigation staff, including contact tracing. The fourth category speaks of school health staff, including school nurses and school health support staff, including behavioral health and contact tracing. And the fifth category speaks about planners and program management staff. Next slide. So I've outlined a few of the key activities that are included in the guidance, and then I'll also talk for a minute about some tips and suggestions as well. The first thing in the guidance is that there is an emphasis on K through 12 school health programs, and it speaks specifically about 25% of the funding being directed to K through 12 schools. And of the remaining funds, 40% of those are allocated or need to be allocated to local public health, including community-based hiring. And this is where you can really consider the needs of the community, the community makeup, and make sure that you are hiring from the community. So there's language in there that supports hiring of community-based workers. In addition to that, few tips and suggestions. We've actually partnered with General Services Administration to develop a contract mechanism that should help you spend some of these funds and assure that you have mechanisms in place to hire staff, whether it's through contract or term mechanisms as well. One thing I wanted to emphasize that I said previously, but we understand that there's a lot of activity related to the grants management of multiple funding streams. And we've included language in the guidance that allows you to specifically build up at the state, local, and tribal level your grants management and grants administrative staff. So that should help you with administering some of the grants. In addition to that, there's language in there about supporting the jurisdiction's activities related to diversity, equity, and inclusion. And so we have some goals and metrics related to that. And funds can be used to help support diversity, equity, and inclusion activities. In addition to that, we want to also let you know that in terms of training and education, funds actually can be used to support professional development, including actual staff that could go back to school and support sustained workforce professional development. One other thing I just wanted to mention before I turn it over is that we are working on a crosswalk document that should help you understand better how the multiple funding streams are intended to work together. And that should help you minister the funds. And with that, I'm going to turn it over to Raul to talk about the disease intervention specialist workforce. Raul.
Thank you, Chris, and thank you everyone for joining us. I'm Raul Romaguera, Acting Director of the Division of STD Prevention. I am pleased to share with you this new initiative to expand the disease intervention specialist workforce. Next slide. The role of disease intervention specialist, or DIS, came into the spotlight as part of our nation's response to the COVID-19 pandemic. DIS stopped the spread of infectious diseases by finding people who are unaware they have been exposed and connecting them to medical care and timely treatment. CDC currently funds a large portion of more than 1,600 DIS who protect the health of the nation. They have been called throughout the years to respond to emerging threats like Ebola and Zika, as well as outbreaks and clusters of hepatitis A, hepatitis C, and HIV. CDC is investing $1 billion over 5 years to strengthen DIS capacity within states, localities, and territories to conduct case investigations, contact tracing, outbreak response, and to link people to care and treatment for COVID-19 and other infectious diseases. CDC is also investing additional resources to update and increase access to DIS training, support peer-to-peer learning opportunities, and conduct DIS applied and operational research. These additional investments will make DIS work more targeted and efficient. CDC will also establish a DIS certification program to provide a baseline for DIS competency nationwide and increase recognition and transfers of skills between states. Next slide, please. On June 21st, CDC and the Department of Health and Human Services awarded $200 million to 59 jurisdictions funded through CDC's core STD prevention cooperative agreement to strengthen the capacity of public health departments in mitigating COVID-19 and other infectious diseases through hiring DIS. We are awarding $200 million per year for 5 years to expand, train, and sustain approximately 1,500 to 1,900 DIS to support jurisdictional COVID-19 prevention and response. Funds were allocated with a funding formula based on the US Census Bureau's community resilience estimates. Recipients are encouraged to consult with their project officer if there are any questions about allowable costs and activities. Thank you. And now I will turn it over to Karen and Sonali, who will share about Public Health AmeriCorps.
Thank you so much. We are very excited and grateful for the opportunity to be with all of you today. I'm Karen Dahl, Senior Advisor for COVID-19 at AmeriCorps. For those of you who may not be familiar, AmeriCorps is the federal agency responsible for national service and volunteering. Approximately 250,000 Americans serve each year in support of community organizations, local and state governments, and other public agencies, national nonprofits, some of which you may have heard of, including Habitat for Humanity, City Year, and United Way. AmeriCorps members serve through one of 4 service programs: AmeriCorps State and National, which has full and part-time roles, flexible direct service, and capacity building. And this is where Public Health AmeriCorps will live. We also have NCCC and FEMA Corps, a full-time team-based residential program, AmeriCorps Vistas, where members serve full-time and capacity building roles to address poverty, and AmeriCorps Seniors for volunteers ages 55 plus. AmeriCorps members typically serve between 9 months and 1 year. They receive a modest living allowance during their term of service, and upon successful completion of their service, members also become eligible for an education award, which can be used to pay off student loans or toward tuition for future education. AmeriCorps has a long history of members serving in public health roles. Here are just a few examples. More than 100 AmeriCorps members have served as recovery coaches to help individuals overcome opioid addiction, providing drug abuse prevention and education, building the capacity of drug treatment and recovery organizations, supporting safe disposal of prescription drugs, improving opportunities for employment for those in recovery, and providing substance abuse screening and assessments. In 2020, the Office of National Drug Control Policy formally designated AmeriCorps as part of the National Drug Control Strategy and Budget, an important milestone in recognition of the value of our work. AmeriCorps also has a 10-plus-year partnership with the Oregon Health Authority, where we place more than 20 AmeriCorps Vista members each year. They serve at public health sites around the state in roles related to health access, health and housing, substance use, health promotion, community engagement, emergency management, and more. We also have programs like National Health Corps, which places AmeriCorps members in public health and clinical settings in multiple cities throughout the country to work on education, access, and capacity as they relate to health and related social services. Service position categories include care coordinator, case manager, COVID-19 responder, health educator, outreach coordinator, and patient navigator. In addition to our existing health-related programs, pivoting and expanding their work like so many did during the pandemic, we also created new programming to support communities. including Colorado's COVID Containment Response Corps, or CCRC, a statewide effort to contain the spread of COVID-19. AmeriCorps members have been working with the Colorado Department of Public Health and Environment to provide surge capacity to local public health agencies, including supporting case investigation, contact tracing, resource coordination, test result notification, isolation and quarantine monitoring, and more. In May 2021 alone, AmeriCorps members and volunteers serving with CCRC completed 45% of the total case investigations and 48% of the contact notifications. Since the program began, AmeriCorps members have served 58,000 individuals, and 84 AmeriCorps members and AmeriCorps seniors volunteers have been hired as part of the Department of Health's paid workforce combating COVID-19 at the end of their terms of service. Additionally, our AmeriCorps NCCC members serving in FEMA Corps have been deployed to vaccination sites across the country during COVID and continuously praised for their work and leadership by FEMA and community leaders. They have helped with site setup, registration, volunteer engagement and management, directing traffic, monitoring, education, and outreach. They were integral in operationalizing FEMA's first mobile vaccination clinics, which were replicated across the country. 49% of our current graduating class was offered jobs with FEMA. More than 600 FEMA Corps members have gone on to work at FEMA since the program began, and the rates have continued to increase over time. To date, more than 36,000 AmeriCorps members and AmeriCorps seniors volunteers have assisted over 11 million people with COVID-related efforts, including 2.5 million people at vaccination sites. They have provided over 34 million meals and 145 million pounds of foods to individuals and families in need. They have conducted over 1.6 million wellness checks, served 3.4 million hours, and registered an additional 86,000 volunteers to serve. These examples illustrate the types of roles that AmeriCorps members can play in public health. And as we head toward a hopefully post-COVID world, we know there will be so much more to do, especially in communities hardest hit by the pandemic. I'll now turn it over to my colleague Sonali to talk about one of the ways AmeriCorps will help in partnership with the CDC through Public Health AmeriCorps.
Thank you, Karen. I'm Sonali Nijawan. I serve as the Director of AmeriCorps State and National, one of the 4 programs Karen mentioned and the largest at AmeriCorps. It's a pleasure to be here with you all today and to be able to share a little bit more about Public Health AmeriCorps. As Karen noted, we have some exciting and meaningful proof points in our work in public health before and during COVID. We are excited about the opportunity to build a partnership with the CDC to help us expand upon these efforts. Public Health AmeriCorps represents a $400 million 5-year investment of CDC American Rescue Plan funds. The program has 2 goals. The first is to help meet public health needs of local communities by providing needed capacity and support in state and local public health settings. The second is to provide pathways to public health related careers by providing exposure through on-site experience, training, and more, with a focus on recruiting AmeriCorps members that reflect the communities in which they will serve. AmeriCorps and our grantees and sponsors are experienced in recruiting from the communities in which we serve and plan to build on this experience and expertise in our work with Public Health AmeriCorps and its grantees. Public Health AmeriCorps also supports President Biden's Executive Order 13996 that includes AmeriCorps in the establishment of a public health workforce program. While many of today's needs are related to the COVID-19 response, the program will also help address broader public health needs of vulnerable communities that have been exacerbated by the pandemic. We will build on expertise, best practices, and lessons learned from existing CDC, AmeriCorps, and other public health programs. We hope that Public Health AmeriCorps will open the door to public health to a whole new population of people and help people think about pursuing careers they may have not known about before. While we are still working to develop key elements of program design today, I'm excited to share some details with you. Public Health AmeriCorps will be part of AmeriCorps State and National and will be administered through a competitive grant process. Eligible applicants include Indian tribes, institutions of higher education, state and local governments and related agencies, and nonprofit organizations, including organizations that act as intermediaries. The goal is to have approximately 1,000 members serve each year, with options for members to serve full-time, which we define as 1,700 hours, or part-time, which would refer to various hour commitments. This will allow for additional flexibility in recruiting from the community. All AmeriCorps placements must be at a public health agency and must place at least 2 members at each service site location. AmeriCorps members receive a modest living allowance, and upon the successful completion of their term of service, they qualify for an education award that can be used to pay off qualifying education loans or can be used for future schooling. AmeriCorps grantee responsibilities include member recruitment, training, placement, and management. Given the scope and goals of the Public Health AmeriCorps, we are also exploring the potential for enhanced member and grantee support. Our members will serve communities and individuals that have been disproportionately impacted by COVID-19, with a focus on equity of access to information, resources, and care. Public Health AmeriCorps will place a focus on recruiting members from within the communities in which they serve, and as COVID has shown, trusted members of the community can have a great impact on the health of a community. There are many roles that AmeriCorps members can play within public health to help achieve its mission to promote physical and mental health and prevent disease, injury, and disability. Some of those roles for members would include community outreach, health education, health service navigation, crisis response, and capacity building. AmeriCorps members do not replace or take the jobs of full-time employees, but rather enhance and help build the capacity of the organizations with which they serve. We are currently in the process of finalizing the Public Health AmeriCorps Notice of Funding Opportunity, which we plan to release in August alongside our annual funding notice. The NOFO will be open for 60 days. Grants will be announced in December or January with the goal of having members serving by March of 2022. Public Health AmeriCorps and the partnership between CDC and AmeriCorps is and will be a shining example of the whole of government approach to helping this country build back better. We are excited to continue to leverage our collective strength and experience to empower others and serve communities who have been hit hardest by the pandemic. Thank you, and now I will turn it over to Patty, who will share about public health fellowships, building a public health workforce.
Thank you, Sonali. We are really excited about the partnership with AmeriCorps. I'm Patty Simone, the Director of the Division of Scientific Education at CDC, Scientific Education and Professional Development at CDC, and I'm happy to be here with you today to talk about public health fellowships. Next slide. At CDC, we recognize that the heart of the public health system is its workforce. We need the right people at the right place at the right time to protect America from public health threats. CDC fellowships and career entry programs are an essential pathway to building the workforce we need. Through these programs and fellowships, we can build a workforce that is appropriately trained, technically expert, and a workforce that is reflective of the diversity within the communities they serve. Not only do the fellows and interns in these programs provide valuable workforce capacity during their training, but 3/4 of them stay in public health when they graduate. The new public health workers we recruit today are the public health leaders of tomorrow, and ARP funded expansions will help open this door wider than ever before. Dr. Ann Schuchat, who started at CDC as an Epidemic Intelligence Service or EIS officer, is retiring after 33 years of service in public health leadership. And she is an example of what something as simple as a fellow recruitment can produce over 3 decades. More recently, Dr. Vikram Krishnasamy, pictured here, participated in the Epidemic Intelligence Service program. And now he serves as a medical officer at CDC. This past October, Vikram won the prestigious Partnership for Public Service Samuel J. Heyman Service to America Medal in the Emerging Leaders category. He also launched an online program that has trained more than 1,000 CDC staff and public health officials on how to support states in coping with the opioid crisis. Next slide. In addition to AmeriCorps and the other programs that were presented earlier, with this new funding, we will expand some of our most valuable and successful fellowship and internship programs. First, we will expand CDC's renowned EIS program and the Laboratory Leadership Service. These are fellows who identify and contain public health outbreaks. These fellows serve in critical roles as boots on the ground responders during every major response, including COVID. And the demand for their scientific skills and leadership continues to grow. We will further invest to make the programs larger and more diverse so that the best and the brightest will continue to answer the call to protect the public's health. Second, we will expand and build on effective CDC career development programs that provide the foundation of the nation's public health workforce. This includes expanding our work with academic partners to build out the CDC Undergraduate Public Health Scholars Program, or CUPS. CUPS exposes students to a range of public health, minority health, and health equity topics and careers. It consists of 6 internship opportunities taking place at 5 partner institutions. A core area of study and practice is related to the health needs of racial and ethnic minority populations and other populations who often are underserved and underrepresented in public health. Through a range of settings, we will expand this program to prepare a larger, diverse body of students to consider public health as a career to ensure a future where the American public benefits from a more diverse and better trained public health workforce. We will also expand the Public Health Associate Program, or PHAP. PHAP strategically places early career professionals in state and local health departments for 2-year assignments to train on public health issues at the community level and serve as a readily deployable force to enhance public health responses. Next slide. Finally, this new funding will also enhance laboratory fellowship programs, expand training, and improve the pathway for qualified professionals serving our nation's public health laboratories. We also plan to implement a new public health internship program for undergraduate students to gain experience in public health laboratory settings. CDC and the Association of Public Health Laboratories, or APHL, will work together to expand the public health laboratory workforce pathway. All of these efforts for our internship and fellowship programs are aimed to broaden and enhance the essential public health services and contribute to a public health workforce prepared to reduce health disparities and pursue health equity. Now, to describe how this funding will be used for capacity building among public health and clinical laboratory communities, I'm going to turn to Dr. Les Dauphin.
Thank you, Patty, and good afternoon, everyone. I'm Les Dauphin, Acting Director of CDC's Center for Surveillance, Epidemiology, and Laboratory Services, and I'm delighted to share information about CDC's Onelab initiative. One of the things demonstrated by the COVID-19 pandemic was how essential public health and clinical laboratories are to the nation's defense against health threats. These laboratories and the vital and talented laboratory staff who work through long days, nights, and even weekends are an essential component of the public health system, and we must invest in their capacity and training and reinforce the connection between public health and the nation's laboratory infrastructure. Furthermore, the laboratory testing community continues to evolve. Individuals who are not laboratory trained professionals, including some members of the general public, are now performing tests and often reporting test results. And there's a great need to provide training and resources for capacity building. To meet this need, CDC has created the Onelab initiative, which will receive support from the American Rescue Plan to create a unified approach to meeting the public health training and capacity needs of America's laboratories. Next slide, please. Onelab is an initiative that started out to strengthen interconnections between clinical, public health, and CDC laboratory education and training professionals to collectively support rapid, large-scale responses. While it still retains that mission, we're now able to expand the initiative to bridge, train, and sustain a capacity-building community among public health and clinical laboratories. Currently, there are more than 800,000 clinical laboratory professionals who work in over 295,000 CLIA-certified laboratories. However, fewer than 10% of those laboratory professionals currently access CDC training and workforce development resources. This program would expand the reach of CDC resources for both the public health laboratory and clinical laboratory community, including those who perform point-of-care testing, building essential bridges between healthcare and public health. The themes of bridge, train, sustain not only capture the essence of our Onelab initiative, but extend to our overall training and workforce development work and resources. Next slide, please. The Onelab network, which is a large component of the Onelab initiative, launched in January, and the new American Rescue Plan investments will help this collaborative network to continue to become a truly national network. As of June 8th, there are 1,834 members, and interest continues to grow. Network members include representatives with responsibility for education and training within clinical laboratory professional organizations, such as ASCLS and AACC, diagnostic manufacturers, commercial laboratories, and hospital systems. We also have some members from public health laboratory. A rapid COVID-19 training needs assessment was conducted with network members in this past spring. Findings were shared at the May network meeting, and education and training resources to meet the identified needs are being released on a rolling basis. We first wanted to start with learning more about the clinical laboratories and how education and training professionals and services existed within that community before we started implementing bridging activities. However, given the interest in the network, the initiative as a whole, and the diversity of our membership, we anticipate bridging activities to be implemented sooner than later. In fact, the network has now become one of those bridging activities since we have members from public health laboratories, and we are starting to see some from non-traditional laboratory settings as well. The goal made possible by the American Rescue Plan investments is a network that will help establish a truly unified response to laboratory training and capacity needs. To discuss another effort to build essential capabilities in the nation's laboratory workforce, I will hand it over to Dr. Greg Armstrong to discuss CDC's Genomic Sequencing Workforce Program.
Good afternoon, everybody. I'm Greg Armstrong from CDC's Advanced Molecular Detection Program. Next slide, please. I'm going to be speaking today about funding that was appropriated through the American Rescue Plan to support sequencing of SARS-CoV-2, as well as sequencing of other pathogens. In the AMD program, two of the most common needs that we've heard of from state and local health departments are number one, cross-cutting funding for sequencing, and number two, support for staff. This ARP funding allows us for the first time to support both of these priorities at scale. The objective of the funding is to accelerate the application of genomic epidemiology in the US public health system. This funding is not pathogen specific and therefore provides an opportunity to create a cross-cutting genomics unit in those laboratories where this is advantageous. The amount includes $240 million for the first 3 years that was dispersed upfront in May through the ELC program. It provides support for equipment, supplies, and staffing. There's additional funding as well for construction, which will be awarded competitively. One reason we put out this funding for the first 3 years up front is to encourage hiring of new staff, including microbiologists, bioinformaticians, and data scientists, or other staff who are needed to implement molecular epidemiology. After the first 3-year period, our intent is to continue funding at similar levels for at least an additional 3 years. Next slide. And now let me hand things over to Dr. Maggie Wanis to discuss the Public Health Informatics and Technology Workforce Development Program.
Thank you, Greg. My name is Maggie Wanis, and I'm from the Office of the National Coordinator for Health Information Technology, and I'm excited to share with you a funding opportunity that we recently released. It is known as the Public Health Informatics and Technology Workforce Development Program, also known as FIT. Before I get into the program, some background on this new opportunity. Next slide. The FIT Workforce Development Program is responsive to President Biden's executive order that calls for creating and sustaining a diverse public health workforce so that the nation can better respond to future public health and biological threats. The FIT program builds upon ONC's past Health IT Workforce Development Program established under the Health Information Technology for Economic and Clinical Health Act, HITECH, in 2010, which trained over 20,000 people. Next slide. The FIT program aims to increase the number of public health professionals trained in informatics and technology with an emphasis in improving public health reporting through modern standards in computing. ONC will provide funding in the form of cooperative agreements to institutions of higher education to establish or expand public health informatics education programs, creating a diverse and inclusive health IT workforce with a focus on engaging minority-serving institutions. We anticipate awarding a total of $75 million through a period of performance of 4 years to selected recipients to expand their existing programs or develop a new program. To train at least 4,000 individuals in public health informatics to improve the nation's public health workforce. Next slide. A few important dates to note. We recently released the NOFO. The applications are due on August 11th, and we anticipate making awards on September 14th. If you're interested, I highly encourage you to visit our site listed here. We recently had an informational webinar last week, and we'll be posting the recording and slides and additional FAQs later this week. And thank you for your time. And at this time, I'll hand it back to Sherry.
Sorry, thank you, everybody. I hope you can hear me. I'm having a few challenges. Well, thank you so much. That was the last of our presentation. So thank you to Maggie and to everybody else. We have so many exciting workforce opportunities. We're putting a slide up for you that summarizes the programs that we discussed on the webinar today.